Labradoodle puppies at 2 weeks old. This is a litter update video for the Kindred Souls puppies. And in today's video, we're going to talk about the fact that we have 2 puppies who are breathing nicely and gaining weight. We're going to talk about what's happened in the past week for that to happen. We're going to talk about Mama Rowan and how she's managing with the grief that she's had to go through in the past week. And we're going to talk about all the positives today. We're going to talk about how these puppies have reached the week 2 milestone. Hi, I'm Claire from Van Isle Labradoodles, and this past week has been a difficult one. We've had 2 weeks of struggles with this litter. There is a rather horrific respiratory illness that is sweeping across Vancouver Island, and sadly, all of the puppies in our litter were impacted by that. We had 4 beautiful puppies, and now we have 2. 2 did not survive the virus, and 2 of them are doing just fine. Now, this involved a lot of different moving parts. Last week we told you about Stevie. He was our lone male, and he did not survive for very long. Now, Stevie didn't really have a good chance at life. He was born very, very small, and he could not breathe through his nose. He was gasping and mouth breathing. So we talked quite a bit about Stevie and how we attempted to support him, gave him every opportunity, but it just wasn't meant to be. And that left us with 3 girls, pink, purple, and red color. Now, everybody was struggling. We only have very limited vet opportunities on weekends in Vancouver Island, especially up in the central part of the island where we're located. And our vet there did their very best, and they prescribed Clavamox, which is a general first-line antibiotic for neonates. It's gentle, it's effective generally, and it does no harm to the puppies. Unfortunately, this disease that is running through the island at the moment, this illness, it's not a disease, is resistant to Clavamox. And very quickly, the respiratory illness develops into pneumonia. Now, adult dogs are even being impacted by this disease, this illness. We've had several dogs who have died within a matter of days, whereas normally young, healthy dogs such as Rowan would not have any trouble with this illness. Now, how did the puppies get this illness? This remains a mystery. It could be that they got the illness in utero because Rowan was exposed to it. She didn't have a problem with it, but she did introduce it to her puppies. Could be. Could be that one of our dogs was carrying the illness, and when Rowan came here, she was exposed to it. Could be that one of our dogs or a visiting dog brought it with them after the puppies were born. I tend to think that the puppies got the illness in utero because when we look back at our notes, when these puppies were born, all of them had what we call wet sounds. So sometimes puppies swallow some amniotic fluid. This is not particularly unusual. And when they're born, you can hear them. They sound like they're sort of gurgling, and their breath sounds are quite wet. So we use a dealie and we suck the mucus out of them. And that's that. And we did that for every one of these puppies. Blue collar boy, the boy who passed away, as I said, was dreadful, way, way worse than I've ever experienced, and couldn't breathe at all. Purple collar girl, she was very, very wet sounding as well. Took a lot more to get her to the point where she could nurse, but she could. She was still messy sounding, but she was able to nurse. Pink collar, a little bit less so, and red collar also had quite a bit of noise when she was born. She was the firstborn, and it really never did go away. At the time, I was not concerned. I didn't even know about this respiratory illness at this point. I hadn't heard anything about it, so I wasn't particularly worried. Sometimes puppies will have a little bit of this gurgly sound, and it just simply goes away within the first few hours. There's lots of other things that you're worrying about, and of course we had Stevie, who we were very focused on for those first few days. In any event, it soon became clear that these puppies were also not doing well. Nobody was gaining weight. So we went back to the weekend vet, and all of them were put on Clavamox, but there was no improvement. And normally, if Clavamox is doing its job, you begin to see an improvement, especially in young puppies like this, really quickly, and definitely within 24 hours, you see things beginning to improve. And we weren't. Things were actually worsening. So when it was Monday, we went to our regular vet, and our regular vet fortunately was well aware of the respiratory illness, knew what was going on, and immediately prescribed. Well, what I did was I emailed her on Sunday night. She had everything ready for us to pick up first thing Monday morning. So they are on doxycycline, which is a tetracycline type of drug. Now that had to be made up at the pharmacy, at a compounding pharmacy. So we had to wait until the end of the day on Monday to be able to pick that up. We weren't able to get it until 5:30 by the time the pharmacy had it all prepared. And the other thing we had was Convenia, which is a long-lasting antibiotic. It lasts for 14 days, and it's given by injection. So we had those ready that we could do right away. And then we also used Medicam. Medicam is something that most dog owners are familiar with. It's an NSAID. It's something that is used commonly post-surgery. It's a pain reliever, but it's also an anti-inflammatory. And it's that anti-inflammatory property that we were interested in giving to the puppies to help reduce the inflammation in their body. So they only had just the bottle touched onto their tongue for 2 days. Medicam, doxycycline, and Convenia are all off-label for neonates. However, they are receiving such a very small amount for a very short period of time that the ROI is definitely there. These puppies would not be alive were it not for them taking these antibiotics. The turnaround after they had the doxycycline was almost immediate. The next morning, they were able to nurse on their own. Now, previous to this, so for Saturday, Sunday, and Monday, the puppies were very lethargic, and they would attach, but they would nurse like this, and then they'd fall asleep. They just couldn't do it. They just did not have the strength. And so we were tube feeding them to supplement them. Tube feeding when supplementing is always something that's a little bit of a gamble, because you have to be very careful in the amount that you feed the puppy. Also, these puppies with pneumonia, they were very susceptible to aspirating. So this is why we didn't syringe feed them or bottle feed them. Our vet's advice was don't do that. That's a huge risk that they'll aspirate. Tube feed them. So at 2:30 in the morning on Monday, we weighed them. We were weighing them every 2 hours, because we were feeding them every 2 hours if they were losing weight. Purple and Pink had lost weight, but Red Collar Girl had not either gained or lost weight. It was my decision that she should get tube fed. That was the wrong thing to decide. That was why she passed away. She aspirated when we tube fed her, and there was no ability to save her. So it was a very bad decision and a fatal one for Red Collar Girl. So we then decided that we would just leave these two, because then we were completely beside ourselves at what had gone on. So that was at 2:30 on Monday morning. We went to the vet later in the day on Monday and saw our vet because I wanted to actually speak to her, tell her what had happened with Red Collar. I wanted her to have her hands on the puppies. I also wanted her to check Rowan and make sure that nothing was going wrong with Rowan. Now, through all of this, Rowan was also drying up. She was losing her milk because nobody was nursing. So there was nothing there. Milk production is increased with the more stimulation that the milk bar gets, and it decreases with less stimulation. So when we're trying to dry our girls up, we limit how much time they're in with their puppies, and that is what essentially makes their milk supply go away. So now we were trying to increase her milk supply. After we had tried to decrease it when she first had mastitis, right when the puppies were born, and we got that underway, then it all dried up because there was no puppies nursing because they were too sick. And now we needed her to get her milk back because after these puppies had their doxycycline treatment, the first one, they were, we're feeling better, we want to eat. So interestingly enough, one of the things that works to help milk production is bratwurst. Who knew, right? Who would think that that would be something to help? Increasing Rowan's food intake of bratwurst and the supplement fenugreek are the things that we were doing to help increase her milk. The puppies also played a huge role in this because they've become stronger and more vigorous hour by hour ever since they've been put on the right meds. So now they're stimulating her regularly. We have not had to give them any tube feeding. The last tube feeding they had was on Sunday. They've been totally fine and they are gaining weight. And I can tell you that they now weigh a really nice weight. So Pink Collar Girl is 835 grams and Purple Collar Girl is 813 grams. Now when we look back to just 2 weeks ago when they were born, Pink was 233 and Purple was 231 at birth. They're doing fabulously. They have not suffered in any respect in terms of weight gain. I'm really happy with how they're doing. They're doing it all on their own. And I can see Pink is trying to make her way over there to the milk bar right now. So I'm just going to move myself out of the way to let them go and have something to eat here. So everything has turned the corner. It's all good news. We're really happy that Rowan is also doing such a great job caring for the puppies and looking after them. So when Red Collar Girl died, the same as when Stevie died, Rowan had a lot of depression. She was very upset. She was crying. She was here when Red Collar passed away, and she went through a grieving period. Now, fortunately for dogs, they do live in the moment, and so their grieving period tends to be fairly brief. By Tuesday, she was feeling better. Now that we're at Friday, she's completely back to her normal self. And the other challenge we had was she wouldn't eat. And so not only did we have to come in and put the food in our hand, she was turning her head away at anything and everything. And when that happens, the girl has to eat because she has to have the nutrition for the milk. She also has to have a good supply of calcium so she doesn't get eclampsia. So when that happens, you have to actually physically open their mouths and put the food in it. It's not something I enjoy doing. It's not a pleasant way to eat. Obviously, Rowan doesn't like it, but for whatever reason, that was what was going on. And then Reynolds had a brainwave. He said, well, she won't eat. Let's not give her food for a little bit. And then we switched and he came in. Well, then she said, oh, sure, I'll eat for you. And so she did. She ate out of his hand. She still wouldn't eat on her own, but she ate out of his hand. So we did that for a few times. And then I was in making breakfast. Our 3 dogs eat in here. And usually everything's closed up because Rowan doesn't like to think that our dogs can get near hers. And she was asking to come out. So I'm like, sure, you can come out. So I let her out, closed the door so the the puppies were behind closed doors still. And I just put her dish down thinking, well, let's see what happens. And lo and behold, she ate it. Yay! And so that was step one. And then last night for dinner, we had pan-fried oysters and prawn risotto. Well, what does that got to do with Rowan? Well, she is hanging around the table going, what do you got? What do you got? And one thing that's really good for dogs to eat and is chock-a-block full of calcium is prawn shells. So I gave her one, thinking for sure she'd spit them out. Our dogs love them. I gave it to her, she ate it. She ate all of my prawn shells, and then I gave her some of my oyster. Well, she just thought this was wonderful. Okay, and since then, she's eaten. So I don't know, maybe the oysters turned the tide. She's still a little bit fussy, so if someone comes in, or if my phone if my phone rings while she's eating, anything that distracts her, that's it, all bets are off, and she quits eating. But we have made some good strides, we're improving, and that makes me have a lot of relief in that I don't worry so much that she doesn't have enough calcium. It also makes me feel better that the puppies have a good milk supply. Now, if you look at the puppies right now, you'll see how they're lying, and you see that they're spread out. So this is not unusual. You'll see purple collar's slightly on her side, and pink collar is that's pink. I got to make sure I got the right one. Yes, this is purple, this is pink. Pink collar is sort of flat, not a little bit on her side, but mostly flat, and purple collar is kind of moving around, getting on top of pink. So what's happened now is when the puppies were ill, of course, they weren't their usual strong selves. And at this point in time, at 2 weeks, I would expect these legs not to be so splayed out in behind, and for her to be sleeping more on her side like this. Because what can happen is their chest can become concave and their limbs will not be functioning properly. So right now with purple collar, we are doing physiotherapy, and part of that physiotherapy involves every time she's sleeping, we put her on her side like this. Now this is a humongous improvement. Yesterday she couldn't do this. Yesterday I had to take a towel, and I had to take some wipes and a bottle of cleaner and a roll of paper towel and squish her so that she could maintain being on her side. She could not get her front legs underneath her. So what I'm doing is I'm just picking her up and I'm just pushing the shoulders in like this. So really it's just like this. And then with the back legs, we're pushing them in and we're making them go in a bicycle movement. So this is called like a swimmer puppy. She's not a swimmer puppy. If she was a swimmer puppy, she wouldn't have improved this much already. Purple collar girl is not quite as having as many difficulties as Pink is, so I haven't done as much with her. She's fine. I know she can lie on her side. She does that quite regularly, but they're not up moving around too much on their legs yet, just because they haven't had the opportunity. All of their energy has gone towards recovery. Now, how about being recovered? Are they recovered? Mostly. Fully? No. We still can hear breath sounds, wet breath sounds, whenever they're agitated or if they're doing a lot of physical activity. Very, very, very minor, and we don't hear anything at this point, whereas before we would have been able to hear them breathing, even on our cameras when we were looking at our monitors or checking them on our phones, we could hear them breathing. You don't anymore, so that is a huge improvement. Will they recover completely? Probably. They should. Nobody can say for sure. This illness is one that is something that is entirely never been seen before, unknown. The fact that it can act so quickly and kill healthy dogs is, something that normally does not happen. So just finding out that it's the doxycycline that seems to turn dogs around. If you live on Vancouver Island, if your dog is coughing, if they're having any difficulty breathing, immediately go to the vet no matter what time it is. Insist on full chest examinations, discuss the respiratory illness, and insist on having doxycycline prescribed, not Clavamox. It's really important that we advocate for our dogs. Vets are incredible people. They're amazing people. And all good vets always want to hear what you have to say. And if you know something or have something to contribute, they are always going to listen to you. Even if you have a puppy, tell them that you're fine with going off label and having the doxycycline. It is going to save your puppy's life. So enough of all of that and illness. Let's talk about some fun things now. So they're really cute. I feel like I spend almost all of my life in here with these guys doing something, whether I'm giving them their medication or we're doing the physiotherapy, or I'm just here going, oh, thank goodness they're all right. I have forced myself not to weigh them every 2 hours. I'm only weighing them once a day now, and I'm trying to force myself to leave them alone. I don't want to overwhelm them with too much. Taylor, who is my assistant, is coming up from Duncan later today. She's going to come spend the night. She's very thoughtful and generous. She's doing that because she said she's kicking Reynolds and I out. We have to leave the house. I haven't left the house other than to go to the vet since the puppies were born. So we're going to take advantage of her being here and go to the farmer's market for a couple of hours. We're also spending tons and tons of time with Missy Moo here, making sure she feels fully supported, secure, and she's just responded beautifully. Her guardians decided not to come back to visit her because they were so emotional over the loss of Red and all of the struggles, and they felt that that might convey too much strong emotion to Rowan and not allow her to sort of relax into her role as a mom. And I agree with that decision. I think that was a very considerate and thoughtful decision to make. Yes. So at week 2, what we are looking for, yes, I know, I love you too. What we are looking for is puppies to open their eyes. Well, we didn't have to wait very long. That's one thing for sure, is even though the puppies have been battling their respiratory illness, they've had no problem making their other regular milestones. And here's Miss Pink Collar Girl showing you her pretty little eyes. I'm not sure she's going to open them. We'll just hang on to her a bit and kind of bug her a bit and see if she won't open them to share with you. Instead, she's probably just going to yawn and say, I was trying to sleep, you know. So you can see what I'm talking about, how her paws are out like that. And what we want is for her paws to be underneath her. So we just hold her shoulders in, just force them there. If they don't go where we want them to go within the next few days, then we will also go a little further and we'll get some stretchy fleece and we will tie them together, hobble her in essence, to hold them into place. Everything's still so small, soft, and malleable that it's easy to reposition them. So now, do you ever wonder why puppies don't open their eyes, why they're born with their eyes closed? Well, it's because the sensory overload is too much for the neurological system when puppies are first born. They have to be a little bit older before they can face the world and take a look at it. And now, right now, they can't see too much. There we go. There's her eyes showing up. All they see is blobs rather, of things. They don't really, they're not able to focus yet. But they are able to take in that fact that there's some shapes. They don't recognize us and our shapes yet, but they are able to determine the people shape is different from the Rowan shape. And that's about as far as they go right now. And then they're putting together in their brains that, oh, that's what that shape smells like. So that then in the future they recognize, oh, that shape is Mama Claire, that shape is Papa Reynolds, and so on and so forth. But for now, all it is some blobs out there for them to take a look at. Now, we haven't done a lot of the ESN we talked about in week 1 because the puppies haven't needed it. They've been exposed to multiple different things, different stressors, so they don't need any more. Now, you see the puppy is twitching here, and you'll see the puppies when they twitch on the ground. See how looks like they're all going spastic. The reason for that is because puppies really don't do anything besides eat and sleep at this point. This is how nature's devised to make sure that their muscles are being used. Now, I can tell you when the puppies were really sick, this didn't happen very much. It was to a much lesser degree. And that's part of the reason why we see these shoulders splayed out rather than underneath them. Now this is coming back and we see them doing all their twitching at a level that is appropriate for 2 weeks of age. So I feel confident saying that at this point they have reached all the milestones and they are behaving exactly as I would anticipate a puppy who's 14 days old would be behaving. So we'll put Miss Pinky down here and let her go see Rowan and get Rowan to give her a good cleanup, and we'll take a look at Miss Purpy. Now Miss Purpy still has a few little squeaks and stuff, but she too is right where she needs to be. She was the one who opened her eyes first. She had her eyes open on Wednesday, so she had her eyes open by day 12. And puppies usually open their eyes anywhere from day 10 to day 21. If it's after day 21, they're off to the vet to have them open to make sure there's nothing wrong ocularly. And if they open them early, that just tells us that their neurological system has developed a little bit more rapidly. It doesn't mean that they're smarter or more intelligent or going to be more advanced. It may mean that their ears open sooner. It may mean their ears open later. And when are their ears going to open, by the way? Well, by the time we do next week's update, their ears probably will be open. Sometimes their ears open really fast after their eyes. Other times it takes a while. I can see Purples are already starting to open. She probably can hear a little bit of sound. And Pink's, I haven't looked at. Excuse me, hon. Can I just look in Pink's ear here? Oh, yes, let Mummy look in the ear. Okay, I can't see right now, so not sure, but Purples are definitely already on the way. So it appears that Purple's just a little bit precocious there about meeting her milestone. So here now I can see. Yeah, and Pinks are open about the same amount as Purples. So that's all of our updates for the puppies. This week for our two families, they're going to be learning in their educational video all about how to choose a vet, a trainer, and a groomer. These are three super important people in your Australian Labradoodle puppy's life. And our little video goes through how to pick those. And the main thing I want to add behind that is just reiterating to everyone, it doesn't matter if you have a puppy, a senior dog, whatever type of pet you have. It doesn't even have to be a dog. Be your pet's advocate when you're at the vet. Make sure you feel confident enough to speak up. If you don't know, ask questions. Ask for them to explain their decisions to you or their approach to you, and make sure it's aligned with yours. Some vets do things one way and some vets do things another. Some vets are very by the book and very cautious. There's many vets who would never prescribe anything other than Clavamox because they just feel that they can't go off of what the book says, what the rules are. Then there's vets who are, okay, I think we should try this. Are you okay with it? My vets always ask me, are you okay with this? They always tell me what the risks are and what the possible rewards are. Sometimes it works. It's not always going to be successful. You may have a dog who's critically ill with something and your vet may say, well, you know, this and this and this is the treatment. It hasn't worked. What if we try this? And it may not be successful either. It's always a little bit of a throw of the dice, but it's something where with these guys, we knew they were going to die, and so we threw everything that we could at them and hoped that something would work, and thankfully it did. So hallelujah. It also helps other dogs who are going to get this illness on the island, because we're able to share that information and say it was the doxycycline. They turned around within hours of receiving it. So that's my 2 cents about vets. I love my vets. My vet is one of the most important people in my life, and your vet is always going to be one of the most important people in your dog's life. And Mama Rowan, she's having a blast going around outside now. And when she's outside, she's comfortable, she's relaxed, she's not so frantically worried about getting back to see the babies. Indeed, now sometimes we have the opposite situation where we've put her in here like this right now to please lie down and feed your babies. And she says, oh no, I think it's time to get up and play. Or, oh no, I think it's time to get up and spend time with mommy and daddy. And so she'll bark and bark asking to come out. But that's okay. I'm quite happy to hear that. That's better than having a dog who's sad and depressed and trying to get over the loss of puppies. We've all been through a hard time, and one thing we have so benefited from is our tremendous Labradoodle community. Thank you all so much for your support, your kind words, all the things you've done, and all of the positive energy you've sent to the puppies to help them survive. It's appreciated greatly. So we hope you liked today's video. We'd love it if you had a moment, if you could pop some comments in here for us. It really helps us out with YouTube. Check out our shorts as well. We have a whole section of shorts that are just like 30 seconds and less. And we hope that you also follow us on Facebook. Thank you for watching, and we'll see you again next week for our week 3 update. And I'll bet you we'll have puppies whose ears are open. Thanks.